So you probably come to this website because you or someone you know has been diagnosed with type 2 diabetes. I want to go over some of the general aspects which led to me writing this book. You're frustrated. As a patient, you're frustrated. You go to the doctor, they do your blood, you're told that you have diabetes, and typically you're going to get put on a medication, and that medication is Metformin. And depending on the prescribing habits of your physician, they're going to tell you, listen, take 1,000 milligrams of this per day, and come see me. And by the way, change your diet, lose weight, and exercise. And in 3 to 6 months, you go back and your blood sugar or your A1C is higher, and that means a change. And what does a change mean to you? It means either more medication or a higher dosage of the medication you're on. And typically, you're going to go through the standard medications that most people go through. Metformin, Glipizide, Glipizide, Actos, Januvia, Invokana, Jardiance. And eventually, your doctor may shake his finger at you and say, listen, you're not listening to my instructions, which is change your diet, lose weight, and exercise. And now we're going to have to put you on insulin. And unfortunately, insulin is one of the most invasive drugs that we have. Studies show it can decrease your lifespan anywhere from 10 to 12 years. And so I get frustrated as a doctor because I know that there are many different things and causes of diabetes. Listen, you're not getting type 2 diabetes because you have a decreased amount of metformin in your system. So therefore, giving you metformin as an answer, as a solution, is not going to be the solution. That's just covering up the disease process, covering up your blood sugar problem. As I like to call it, you're treating the smoke and not treating the fire. This book is for people who want some solutions, remedies. You need to get properly tested. You need to test your liver, which is probably the most important organ in terms of regulating your blood sugar. Your adrenal glands, if you're getting tired, if you can't sleep, can't fall asleep, you're having an adrenal gland issue. There's 8 different stages of adrenal gland fatigue, and each one leads to a different treatment program. This book is about telling you that there are many, many different reasons why a person can't regulate their blood sugar. And if we lined up 1,000 people, we would have 1,000 different reasons. Anywhere from thyroid issues, adrenal, your gut, fatty liver, leaky gut, hypothyroidism, hyperthyroidism. You could have an autoimmune aspect, which makes you a type 1.5 diabetic. So there are 4 different types of diabetes, actually. Most people know of type 1, there's type 2, but then there's also type 1.5 and type 3. And type 3 is also known as Alzheimer's. So if you're tired of the same old pill for an ill model, medication covering up your symptoms, what I call, again, treating the smoke and not treating the fire, then this book might be for you or for someone you love. And without getting too dramatic, this could be the solution to the rest of your life about actually becoming non-diabetic and reversing your diabetic condition. And when I say reverse your condition, what I mean is reduce and eliminate the need for prescription drugs across the board. Not only your diabetic cocktail, which typically consists of blood sugar medication, triglyceride or cholesterol medication, as well as high blood pressure medication, but across the board. And so once you get to the cause of the actual problem, you can find a solution and then reverse the diabetes. And the great thing about what we do is it's all on the lab in black and white. No matter which lab you go to, we're going to see objective data showing you that you're actually reversing the diabetic process. So again, 3 myths most commonly for diabetes are that it's due to your age, weight, or genetics. Well, there has never been a gene linked to type 2 diabetes. There has never been a textbook written that says once you reach a certain age, you're going to get a certain disease, such as diabetes. And weight, I have at least 3 or 4 90-pound patients and are full type 2 blown diabetics. And they're not heavy or even obese for that matter. So again, if you're looking for a solution to reversing your diabetes and changing your life, the book might be something you would like to pick up and read. Thank you very much.